Today we're going to talk a little bit about the liver. A fish tank filters water the same way a liver filters blood. The liver is the largest, most complex organ in the abdomen, weighing in at about 1,500 grams. It's divided into three main lobes: the left lobe, the right lobe, and the caudate lobe. The left lobe is located in the epigastric region, and the right lobe is located in the right hypochondriac region. In some cases, the liver can extend to the left hypochondriac and umbilical regions. It is mostly retroperitoneal, with the exception of the gallbladder fossa, IVC, and Barrett area. Almost all of the right and left lobes are covered by our ribs. Many things hide behind the liver, like the stomach, right kidney, IVC, aorta, and pancreas. The space between the liver and right kidney is called the Morison's pouch. It is important to check here for abnormal fluid called ascites. Surrounding the entire liver is a thin layer of connective tissue called the Glisson's capsule. It gives the liver soft tissues its shape and strength. The falciform ligament attaches to the back side of the liver, and it suspends the liver from the diaphragm and abdominal wall. A rounded ending of the falciform ligament that extends upward toward the diaphragm is called the ligamentum teres. It's divided the left lobe of the liver into medial and lateral segments. This is also called the umbilical ligament or round ligament, and it looks like a bright dot. The ligamentum venosum is a bright horizontal line in front of the caudate lobe, in between the caudate lobe and IVC. It separates the caudate lobe from the left lobe. Located on the back side of the liver is called the transverse fissure, also called portal fissure. This portion of the right and left portal veins. The interlobar fissure is what divides the right and left lobes of the liver. It outlines the lateral portion of the left lobe. It looks like a bright line from the portal vein to the neck of the gallbladder, and it's actually used to find the gallbladder. The interlobar fissure is also known as the main lobar fissure. The opening of the liver, or the hilum, is where vessels enter and exit. This is called the porta hepatis. As I mentioned, the liver is divided into lobes, technically four: right, left, caudate, and quadrate, but really only the right, left, and caudate are considered true lobes. The left lobe of the liver is the most anterior lobe, extending from across midline, epigastric to left hypochondrium. It's located in front of the porta hepatis, gallbladder fossa, and left umbilical vein. The right lobe of the liver is the largest lobe. It's located in the right hypochondrium. It's in front of the lower surface of the gallbladder fossa, IVC fossa, and porta hepatis. The caudate lobe is the smallest lobe on the lower backside of the liver surface. It's below the ligamentum venosum and between the IVC and ligamentum venosum. The caudate lobe is not seen on an ultrasound, but is located on the front lower surface of the liver. Sometimes a person's right lobe is extra long. This is called Rydell's lobe, and it's totally a normal condition, usually seen in women. Also, the liver is divided into segments according to vascular supply, which is used for surgical resection of the liver. Okay.
As Krista mentioned, the liver is also divided into 8 segments. Similar to a fish tank, here is divided into different segments, and each segment has its own filtration system. The segments are divided according to the vascular supply. It is divided by the branching of the hepatic and portal veins. There are 3 hepatic veins: the right hepatic, left hepatic, and middle hepatic vein. There are 3 veins that divide the liver longitudinally into 4 segments. The right lobe is divided into medial and lateral segments by the right hepatic vein. The left lobe is divided into medial and lateral segments by the left hepatic vein. The middle hepatic vein divides the liver into right and left lobes. Then the portal vein divides those segments transversely to create 8 segments. Each segment is independent with its own vasculature. These segments aid in surgical resection. The liver receives approximately 75 to 80% of its blood from the portal system and approximately 20 to 25% from each flow. The portal system carries nutrients from the gastrointestinal tract to the liver. It includes the splenic vein, the inferior mesenteric vein, the superior mesenteric vein, the main portal vein, the right portal vein, and the left portal vein. The splenic vein drains blood from the spleen, stomach, and pancreas, then joins with the inferior mesenteric vein, which drains blood from the intestines. After they join, the splenic vein becomes the portosplenic confluence, and then joins with the superior mesenteric vein, which also drains blood from the intestines. At this point, the portal splenic confluence becomes the main portal vein, which passes obliquely and right posterior to the hepatic artery. The main portal vein then enters the liver at the porta hepatis and branches into the left and right portal veins. The right portal vein divides into anterior and posterior branches, then superior and inferior. It supplies blood to the right lobe and caudate lobe and is the larger of the two branches. The left portal vein divides into medial and lateral segments and supplies blood to the left lobe and also the caudate lobe. Portal triads occur throughout the liver. They consist of a portal vein, hepatic artery, and bile duct. Each liver segment has its own portal triad. The arterial system consists of the common hepatic artery, proper hepatic artery, right hepatic artery, and left hepatic artery. The common hepatic artery arises off the celiac axis, which arises off the aorta. It branches into the right gastric and gastroduodenal arteries. The common hepatic artery then becomes the proper hepatic artery and enters the liver at the porta hepatis. It then divides into right and left hepatic arteries. The right hepatic artery is larger than the left and supplies the right lobe of the liver. The left hepatic artery supplies blood to the left lobe of the liver. The venous system consists of the right, middle, and left hepatic veins and the inferior vena cava. The right hepatic vein is the largest of the three and drains the right lobe. It enters the inferior vena cava at the right lateral aspect. The middle hepatic vein drains the middle portion of the liver and enters the inferior vena cava at the anterior or right anterior surface. The left hepatic vein is the smallest of the three and drains the left lobe. It enters the inferior vena cava at the left anterior surface. The inferior vena cava lies in a groove along the posterior surface of the liver and travels through the diaphragm to the heart.
So first we're going to talk a little bit about anatomy and physiology. The cytoplasm of red blood cells is mainly a solution of hemoglobin. This is the red pigment, about 33% of your red blood cells. Its role is mostly to carry the oxygen to all parts of the body, as well as carbon dioxide and maintaining your blood pH levels. So we have heme, which binds oxygen to iron for transport, and globin, which is the protein part of the cell. The liver is broken up into the lobules, as Louise mentioned before, and they're kind of like tiny cylinders. The lobules have a central vein passing through its core. The lobules are where the hepatic portal vein and hepatic arteries meet each other. This is where the liver cells process the blood cells. Once processed, the blood collects in the central vein and it ultimately converges in the right and left hepatic veins and exits the superior surface of the liver to empty into the vena cava, similar to these three representations of the liver here. The liver is the blood filter for the body. As Louise and Krista mentioned earlier, the liver is the blood filter for the body. The liver receives about 20% of its blood supply from the hepatic arteries, and this is fresh oxygenated blood used for liver function. The remainder of the blood the liver receives is from the portal system, about 80%, and this is deoxygenated blood. The portal system receives blood from the inferior mesenteric vein, the splenic vein, and the superior mesenteric vein. Basically the stomach and the intestines with some spleen and pancreas thrown in for good measure. All this blood enters the liver at the hilum or porta hepatis, basically the entry and exit area. The liver filters the blood with its hepatocytes or liver cells. The hepatocytes absorb glucose, amino acids, iron, vitamins, and other nutrients for metabolism and storage after a meal. They also remove hormones, toxins, biopigments, and drugs from the blood. At the same time, they secrete albumin, lipoproteins, clotting factors, and other products into the blood. And then between meals, the hepatocytes break down stored glycogen and release glucose into circulation. All this takes place in the blood-filled channel within the liver called hepatic sinusoids. The hepatic sinusoids also contain hepatic macrophages known as Kupffer cells, which remove bacteria and debris from the blood. So, red blood cell production is called erythropoiesis. The blood cells are formed mostly in the bone marrow after we are around 4 or 5 years old, and they generally live for about 120 days. Once they are old or damaged, most are broken down in the spleen. So let's imagine that this water is your blood, and that this big rock here is your spleen, where the blood cells go to die. It's kind of like the red blood cell graveyard. Once the blood cells are dead, they are transported through the splenic vein into the inferior, with the inferior mesenteric vein and superior mesenteric vein, and they carry the deoxygenated blood and broken down blood cells to the liver for processing. Okay, are you still with me?
Still with you.
Good. Imagine, if you can, that the filter is the liver. Inside, the hemi part of the hemoglobin is broken down into biliverdin, and then it is rapidly reduced into bilirubin, which is the greenish pigment. This process can occur in the bone marrow and spleen also. If it is produced elsewhere, it is still sent to the liver, and either way it reacts with a sugar and becomes conjugated. Conjugated just means that it's water soluble. Is your brain spinning? I know mine is. Now that the bilirubin is water soluble, it is excreted into the bile. The bile is then transported to the hepatic duct via the bile ductules. The bile ductules drain into the left and right hepatic ducts, which then drain into the cystic duct to be stored in the gallbladder. Pretty amazing, huh? Now the gallbladder is another story. Our story ends here because we just have the liver.